Oh, well, hello. Hello, 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 hello. My name is Nurse Calm, and I am going to be conducting your cranial nerve examination today. Now, we are going to crack straight onto it because I just can't wait to get my little hands on you. Okay? Great. Well, I think we should have everything that we need. I just need to take a few details from you first, though. Is that okay? Great. Okay. Just move some bits and bobs about. And here we go. Okay. So, could you please confirm for me your full name? Lovely name. And your date of birth. Oh, very nice. And could I confirm your home address? Oh, that's a very nice area. Look at you go. Very impressive. Okay, and would I be able to take an email address? You'll just be kept up to date once a month with our newsletter, and also if you'd like an email copy of your results. Great, you can opt out at any time. Amazing. Yep. Okay, great. May I say, I don't know if you get this a lot, but you have the loveliest voice. And wow, the most enchanting eyes. Yeah, I hope that's not too cheeky of me to say. Good, good. I won't want to make you feel uncomfortable. Okay. Sometimes I do get called Nurse Cheeky instead of Nurse Calm. Just because I like to, I like to be a bit friendly. I don't think there's anything wrong with that, do you? Great. I think we are going to get along very, very well. Okay, now this part is about your medical history. Okay, so do you have any current medical conditions that you are receiving treatment for? Okay. And are you currently taking any medication? Okay, just for anything at all. It could be like hay fever, just anything. Okay. Have you had a serious medical condition or injury within the last 5 years? Okay. I could just listen to you talk all day. Sorry, I'm trying not to get too distracted. Right, where were we? Have you ever had a cranial nerve examination before? Okay, that's fine. Well, you may be familiar with quite a lot that we do within the examination, such as an eye test, hearing test. So nice and simple, nothing too strenuous, I promise. Okay, and you're in very safe hands. And if at any point you would like to hold my hand for comfort, you just let me know. Okay. Right. Okay then, well, if you're happy to go ahead, then we shall proceed with the examination. Fantastic. Oh, I just need to double check, do you wear glasses at all? For computer or screen use? Okay. Great. And to your knowledge, do you have any issues with your hearing or issues with your sense of smell or taste? To your knowledge. Okay, fantastic. Right then, we can begin. I sort of want to take my time with you just so I can keep you in here for a little bit longer, but must be professional, must be professional. Right, okay, let me get some gloves on. Now, where would you like to start today? The cranial nerve examination, just to explain, just checks all the nerves that are supplied to this zone. Okay, so there are about 12, and by conducting this examination, it's a really good way to spot if there could be any issues. So you seem like a very fit and healthy person to me. Emphasis on the fit. So I am sure you'll be absolutely fine. But as you said, seeing as this is being offered to you, you may as well have a go at one. Yeah. Okay then. Would you like to begin with an eye examination? Yeah? Fantastic. Okay then, we'll start off nice and simple and we'll begin with a peripheral vision test, okay? So what I'd like you to do now, I don't want you to strain your eyes too hard here, but if you could focus directly on me, I know there's a lot to look at. And all I need you to do is I want you to tell me as soon as my finger goes out of your field of vision. Okay, so let's begin with a little test one. Fantastic. I can tell you're going to be good at this. Okay, right, just relax. I think we've got a little bit of a noisy patient next door, so try and tune them out if you can. Good. Good. Okay, we're going to try with both fingers. Only tell me when both go out of your vision. Okay. Good. Good. You're doing so well. I must admit, I'm rather enjoying you staring directly at me. Good. Just a couple more. Fantastic. You little superstar. That was so good. So good. I can tell you're going to be my star patient of the day. And they get extra special treatment. Yes. Okay, so next with the eye examination, what I'd like to do just before we do an official Snellen chart, which is the same as an optician's eye chart that you'll be used to, I'd just like to look a little bit closer into the eyes with a little pen torch. Okay, so just like this. Your eyes may blink and be a bit sensitive, they may also water. Don't worry about that. Okay, you just look straight ahead again at me, or you're welcome to look behind. Okay, I'm just going to come a little bit closer. Oh, you smell so good. Oh, sorry, you. Oh, you smell so nice. Yeah, I'm very attracted to scent. Anyway, okay. So, just have a little look. I'm just going to look down into the eyes here. Okay. That's okay, you don't move or do a thing. I will do everything. Okay. Alright. So, if you wouldn't mind, could you just follow the light for me with your eyes? Okay. Good. I won't make you do this for too long because I know it can make eyes very sensitive. Okay. Great. And now I'm just going to move the light in and out, just checking your pupil reactivity. Okay. Do you have any blurred vision, any pain in the eyes, any headaches, any dizziness? No. Okay, great. Do you experience eye strain or dry eye? Okay. Look just down here. Look down there. That's great. Just a little look. Just here. Okay. Just gonna have a little look just here. Okay. Do you use any eye drops at all? Okay, good. Good. They're a good idea if you use a screen. Just get a basic sort of lubricating one, and that's quite good. Okay. Wonderful. Okay. Wonderful. Just let your eyes adjust for a moment. You really do have such a little squidgeable face. Oh no, that's a very good thing. And more importantly, your eyes look fine. They do. I just had to go through the motion of doing all the different tests. So just bear with, but we are on track. You're doing very, very well. I'm very impressed. Okay. Great. So let's move on to that Snellen chart. As I say, you'll recognise this when you've been to the opticians. Just move a few of my things around. Sorry. Okay, where's our Snellen chart? Yes, no, you'll notice one behind. I'm just going to get my one from here. Okay. Great. And where's my little pen? Okay. So, with this, I'm going to ask you to cover one eye at a time. Alright. Now, I'd love to stare at both of those beautiful eyes, but needs must. So when you're ready, just place your hand over one eye, and could you take 3 steps backwards? Fantastic. Okay then, starting from the top. Good. Fantastic. Good. And the next line. And the next line. And this line, please. Great. And take your time with the next line. Wonderful. And anything from this line. Great. Let's see if we can get anything from this line. I'm very impressed so far. Wonderful. And anything from this line? Okay, let's just stop there then. Great. Okay, and uncover your eye. And cover the other eye. And when you're ready, from the top again. Next line. Next line. Good. The next line. Good. And this line. Great. And this line. Excellent. And this line. Let's see if we can get any further. Okay, and this line. Yeah, no, that's fine. Okay, and uncover your eye. Wow, you did very, very well. Oh, no, honestly. Let me just make a quick note. I must say it's lovely to get a patient so charming and lovely. Does make it a little bit harder to focus though. Can't complain though. Okay, perfect. Vision's quite similar on both eyes. Can't see any immediate issues. I do have to check your colour blindness though. Now I imagine you think you see colours normally. Never had an issue. Okay, well let's just have a little double check. Alright, let me get my chart. Okay, so chart looks like so. And as you notice, there are numbers within these circles. Okay, you can keep both of your eyes open like that, and all I'd like you to do is, starting from here, working your way across, just let me know the number that you see within the circle. Yeah, in the middle one. And this one. And the next line. Great, and the middle bottom. And this one here. Okay. Wow. You have the best eyes. No problems at all. But to be honest with you, even if there was a little problem, you would still have the most gorgeous eyes. Okay then, fantastic. Eyes done. Tick, tick. Oh, right. Well, let's move on then, as we're doing so well. Now, I think I'll test your olfactory nerve, that lovely, lovely nose and its sense of smell. Now, this one's quite a fun one. I rather like this. What I'm going to do is I'm going to apply a little bit of pure essential oil that has familiar scents, and you are just going to identify them for me. Okay, I've got 6 for you. So let me get bottle number 1. Open it up. Give it a little bit of a stir around. Okay. Pop it on there. Okay. And just have a little smell for me. What do you think? Okay. Should make a note of these as we go along, shouldn't I? Number 1. Okay. Great. Let's get to the next one. I need an extra set of hands for this. Yes. Okay, next bottle. We'll shake around. Okay. Dab, dab, dab. All right. What do you think? Okay. Oh, very specific. I like it. Okay. Bottle number 3. Oh, I need to get some more of this one. Okay. What do you think? Okay. Great. Number 4 then. Okay. Nice deep sniff. Let's give you another smell. Ah, goodness, making me hungry. I know. Okay, last one. Now this one can be a little bit tricky, but I believe you can do it. Okay. All right. Right. Well, I can reveal that you have the best nose. Boop. You do. You do. So, number 1 was indeed cinnamon. Well done. Tick. Number 2 was indeed chocolate, and you actually specified milk chocolate, and that was correct. Yes, I would have taken any answer of chocolate there. Bonus star points for you. Now, number 3 was indeed mint. Well done. Yeah, I would have accepted peppermint or spearmint or any type of minty answer. Number 4. Oh, one of the nicest smells. Garlic. Oh, it always makes me hungry. and goes fantastically with number 5, which was rosemary. Yes. Oh, do you like to cook? When was the last time you had a proper home cooked meal? Oh, well, perhaps I will have to do that for you. Okay, and number 6. Now, this was the tricky one. You said strawberry, and I will accept that, but it was actually a type of candy, so it was strawberry laces. Yeah, but they do smell of strawberry, so it's all good. All good. Any type of sugary sweetie answer I would have accepted. Yeah. Fantastic. Okay then, no issues there. Alright, so just going to start to test some other things. Now, what I'd like you to do for this next one is this is testing sort of skin sensitivity and the nerves on your skin of your face. So what I'd like to do is I'd like to ask you to close those lovely eyes, and I'm going to place a little bit of cotton wool just on different parts of your face, and I'd just like you to tell me what part of your face it's occurring. Okay? Fantastic. Nice and gentle, I promise. So just close your eyes for me. Okay, so tap. Good. And tap. Good, you're doing so well. And tap. Good. And tap. And what about? Good. And how about here? Good. And here? Fantastic. And here? Okay, wonderful. Open your eyes now. Well, you are just so good. So good. Okay. No problems there. Now, I am just going to ask you to do a couple of very simple things. So firstly, I'd like you to just simply raise your eyebrows. Okay, and back down again. Can you give me a nice frown and a nice smile? Oh, such a gorgeous smile. Such a gorgeous smile. Okay, now what I'm going to do is I'm going to try and turn your frown into a smile. Okay, and I'd like you to try and resist. Okay, so frown for me, nice and frowny, good. And try to just resist me pushing your mouth up into a smile. Fantastic. Okay, great. Another thing checked off the list. Good. Right, let's just check your taste. Okay, now I just have a couple of things here just to differentiate. These will just dissolve on your tongue. Okay, so let's do one first. They aren't unpleasant, don't worry. Just open wide. Should just take a few seconds. And what do you think that is? Fantastic. Feel free to just have a little sip of water just there. Okay, and we'll place the other one on. And what do you think that one is? Sort of guess that. Okay, good. But you can definitely taste it. Fantastic, yes. So one was salty and one was sweet. When you go to the cinema, what type of popcorn do you like, just out of interest? Just in case we happen to go. Nice. Oh, we can definitely go to the cinema together. Well, sometimes, to be honest with you, I love just salted popcorn, and then I'll chuck a load of like chocolate, like Minstrels or Maltesers or something in it. I love that combination. Yeah, I do like a mix. Yeah, we're all good. Oh, good. Okay, fantastic. Well, last but not least, I'd like to check your hearing. Okay, so for this, I would like you to please step back behind that little black line on the floor. Yeah, that's the one. Oh, so far away. And what I'd like you to do is I would like you to close your eyes again in a moment. And what I'm going to be doing is just whispering words just side to side, just so different sides can hear. And what I'd like you to do is just say those words back to me. Okay, the reason why I'd like you to close your eyes, even though it makes me sad I can't see them, is so that you can't lip read. Okay? Fantastic. When you're ready then, close those beautiful eyes. Okay, so let's start with an easy one perhaps, and let's try nurse. Good. And perhaps cranial. Good. Let's try some unrelated things perhaps. Bottle. Good. Brush. Gloves. Good. Comb. Excellent. Just a couple more. Scissors. Good. And last one, clipboard. Fantastic. And open your eyes and come back to me. Oh, so cute. Okay. Well, everything looks absolutely wonderful. Now, I know you said you haven't been for a checkup or anything in a while, so whilst you're here, would you like me to do your height and weight, just so we've got it on record? Yeah? Yeah, of course. You can leave your shoes on, that's fine. If you'd just like to step on the machine and just press the red button next to that little blue one. Okay, just so I can see the little reader. Stay nice and still. Very good. And your BMI. Fantastic. Okay, just step off. You are within a healthy weight and height range. That's fantastic. Well, not that you can be within a healthy height range. It doesn't really matter what height you are, but you are still a very good height. Very good height. Okay. Now, would you like me to have a little listen to your chest, just as a general little checkup? Yep. Just ask you to breathe normally, nice and steadily. Okay. Fantastic. And do you eat well and exercise? Yeah? Well, consider me very impressed. It's quite rare these days with people leading such busy lifestyles. Yeah, so well done you. Yeah. Now, just one last thing. What I just want you to do is I'd like you to try and resist when I push down your shoulders. Okay? Just a little test, okay? Good. Oh, you're very strong. Very strong. Well, unfortunately, that is the end of our cranial nerve examination today. Now, I can confirm that I see no areas of concern. So, well done you. Would you like your results emailed to you? Yeah? Fantastic. Would you prefer that over a paper copy? Okay, great, thank you. Save the planet and all that. Yeah. Great. Do you have any questions at all? You are so welcome. You are so welcome. You are definitely my star patient of the day. And my cutest patient of the week. Yeah. You're most welcome, and I hope you enjoy the rest of your day. And maybe I'll get to see you again soon if I'm lucky. Perfect. Alright then.